Welcome to this edition of Phenomenal Health. I'm Dr. Jeff Hawkins. Today we're going to be discussing the most popular non-surgical and non-drug treatment for pain in the United States. If you're suffering with any kind of pain and you're looking for a natural way to correct it, then you better stay tuned. You're really going to love this show. Don't go away. We'll be right back.
Welcome to Phenomenal Health. Phenomenal Health is informative and exciting. Phenomenal Health interviews leading experts in all areas in healthcare, so you become a much more informed consumer. Now, here's your host, Dr. Jeff Hawkins.
Welcome back. I'm Dr. Jeff Hawkins, and you're watching Phenomenal Health. I'm very fortunate to have with me today Dr. Amie Bend, who is a doctor of chiropractic. Dr. Bend graduated from Life Chiropractic College, one of the best colleges in the country, and is a state of California licensed doctor of chiropractic. Dr. Bend practices in Arroyo Grande, and she's here today to discuss how chiropractic has become the most popular non-surgical treatment for pain that exists today. Dr. Bend, welcome to the show.
Thank you.
Well, thanks for being here. I appreciate you coming on and taking some busy time out of your schedule to come in here and talk about chiropractic. So first question I have for you is, why did you decide to become a doctor of chiropractic?
Well, my dad's a chiropractor. Our family's been serving actually since 1925. My great-grandparents were chiropractors. So it's something that's in my family, and I believe in it. I also believe how much health comes from natural healing and not taking outside things into your body to heal.
Right. So, and now, why don't you tell people watching, because I know when we're doing research preparing for this show, chiropractic is becoming extremely popular. It really has the last 15, 20 years. You got professional athletes, celebrities. I mean, it seems like everybody's going to chiropractors now. So why do you think it's become so popular?
Because it works. Chiropractic is popular because it's a natural means to health. We all know that prescription medications often have side effects that actually harm us. So people are more attracted to taking a natural approach to finding their wellness.
Right. That does seem to be the craze right now. So I think people are sick and tired of taking drugs like you mentioned. And I know my family and everybody else that I know in my circle of friends, they don't want to take drugs. They don't want to go into the knife and get cut. So this seems like a logical alternative. So why don't you explain to people watching as well now, what is chiropractic? How does it work? Explain that to us.
Chiropractic is a philosophy, science, and art, and basically what it is involved with is the nervous system. It's the brain and spinal cord that are involved primarily with how your body feels, and it's protected by the skeletal system. So basically what chiropractic does is it removes something called a subluxation, which is a vertebrae that's twist or misaligned somehow, and the body then, the spine presses on the spinal nerve, and then when that happens, pressure occurs, and then the nerve does not get its message across to wherever it may be going. So chiropractic is the process by which it finds out where that misalignment is, and then it corrects the misalignment, opening up the nerve flow again to wherever it has been stopped or slowed down at.
Okay, makes sense. I mean, if there's some pressure on a nerve causing a problem, the only way you're going to fix it is get the pressure off the nerve. I mean, that makes kind of logical sense. So can you show us on the spine, or this model, doctor, exactly what that does, or show us a little bit of the anatomy and how a nerve can actually get pinched?
Okay. Well, this is the vertebrae in the spinal column. Okay, there's 24 bones in your back, and so basically the vertebrae are protecting and holding a structure for your muscles to stand, to hold your structure with. And then the vertebrae also cage the spinal cord and the spinal nerve, so the cord fits through the top there, and then out the side of the bone comes the nerve. And when the vertebrae rotate, they can oftentimes put pressure on that spinal nerve that may go to your muscles or tendons or ligaments, and also it may also get to your organs or cells or tissues at that same level. The vertebrae are also supposed to have motion in them, and in that motion they will facilitate fluid into that disc space, and oftentimes back pain comes from disc injuries. And so basically when the vertebrae aren't moving properly because they're misaligned, then the disc doesn't get hydrated the way it's supposed to, and also the nerve flow doesn't get the appropriate message to the muscle, creating numbness, tingling, pain, or dysfunction.
Okay, so I mean, it sounds like the whole thing is kind of centered around these nerves. They can't be pinched, otherwise you're going to have problems. So once you've done your analysis then, and you found out that some of these vertebrae are misaligned, pinching on the nerves, how do you correct it? What do you do to put everything back in place?
Well, I use gentle methods in my clinic. We use either manual by hand. I'll go and touch the spinal column with my hands and gently reposition the vertebrae through the muscles and tendons and ligaments that are obviously on top of the bones. We also use something called activator methods, which is an handheld instrument that gently just pushes the spine back into its correct position without hearing any clinking noises. So some
Okay.
people do have fear of the actual adjustment,
Right.
and so we provide both methods in our clinic.
Now, what does it feel like if someone comes in and say, I've never been to a chiropractor? I mean, does it hurt to get adjusted? Does it feel great? I mean, what does it feel like when you actually correct the spine?
Usually it's a relief unless you've come in a lot of pain, and then we just use gentle approaches which gently relieve pressure, so it usually just feels like your pressure has been taken off your spine.
Okay.
And it's usually very comfortable, and actually endorphins often go off, so oftentimes you feel a lot better after an adjustment.
Right. I know when I get adjusted, it feels awesome. And I've been getting care myself since I was 4 years old, and it's incredible. So I just want to make sure people that are watching know that I go personally, and it just feels incredible, and I wouldn't do anything else. So I know in your office, Dr. Ben, you kind of focus really on correcting the cause of people's problems, like their pain or whatever's going on. You don't just kind of treat their symptoms like a Band-Aid. So explain to us a little bit about that corrective philosophy that you have in your office.
Well, what that is involved with is that we don't believe that your symptoms are the cause of your problems, they're the result. So
Okay.
usually the symptoms are the last to appear and they're the first to disappear. So a
Okay.
lot of people take medications to mask the symptoms, but actually what happens is when the symptom is there, the tissue damage has already started to occur. And so basically your body's deteriorating as a result of not dealing with the cause of the problem. So
Okay.
what chiropractic is fundamentally based on is that we want to find the cause of why the symptom has occurred. So if it's because the vertebrae is misplaced and there's pressure on it and it's choking off the nerve flow, you're taking a drug of some sort isn't going to get rid of that pinch off of the nerve.
Okay.
So-
So again, it makes sense. I mean, it's either put a Band-Aid on it, which is temporary, or do what you do, which is going to really be looking at what's causing the problem. And I really want to make sure people watching understand that, because that's a huge misconception in healthcare, that just because you get your symptoms taken care of, that you're healthy. And you can, you see that in dentistry, where you can have a cavity and not have any pain in your teeth. And it's sort of the same thing with your spine. It looks like that you can have problems but not have any symptoms yet. So that's why they should come and get a checkup by you, right?
Right.
Now tell the people watching also about the computerized testing that you do in your office and what that shows and how cool that is.
Well, one of the ways to determine if you have a subluxation is by determining the amount of motion in the spinal column. So we have
Okay.
a system called the Myologic, and basically what it does is it measures your range of motion in your spine and your limbs as well to determine how well they're working, and it also determines muscle strength. So we
Okay.
actually test that with a computerized assessment.
Okay. Now is that something that once you've given them some care, you can retest it and show people the before and after?
Absolutely.
See, that's very cool, because that's what I think I love about offices like yours, where you can test people ahead of time, give them some care, then retest them so they can see the before and after, because that's what I think a lot of people want to see. It's like putting braces on your crooked teeth. They're crooked when you start out, and then you put the braces on, you take them off, they're straight. You can see the progress. So it's neat that you have that kind of stuff in your office. Now, tell the people watching about the offer that you have. I know you have different offers going on, so explain that a little bit to them.
Well, basically we have different offers throughout the year. So when you call in, we will have an offer for that month. Usually is how we divide our offers. So when you call in, we'll tell you what that offer is for our month, and we'll give you that offer.
Okay, excellent. Okay, now we have to take our first break right now. As we go to the break, we're going to hear from some of your patients that are getting great results in your office. And when we come back, we'll keep talking about this, okay? So sit tight. Now, if you're suffering with any type of pain and you're looking for a natural way to correct it without using medications or surgery, then you need to call Dr. Ben's office and make an appointment to see her. As a doctor of chiropractic, Dr. Ben has special training at correcting most types of pain in your body. When we come back from our first break, we'll talk about what kinds of pain can be caused by misaligned vertebrae or subluxations, and we'll continue to talk about why chiropractic has become the most popular, non-surgical, non-drug treatment for pain in the country. We'll be right back.
My family and I have been going to Ben Chiropractic for about 5 years now. I had first started going because I'd cracked my tailbone, and Dr. Ben was able to relieve some of the pain. In those 5 years, I've played many different sports, and she can help with my back, my neck, my knees, and my ankles. I've now taken up running, and the pounding on the pavement is really hard on my back, but I know that Dr. Ben will take care of me. My family and I all get adjusted, but it's my mom who likes the massages best. The environment is very welcoming, and the atmosphere is very friendly.
I have been under chiropractic care for over 21 years, and the last 6 years with Dr. Amie Bend. I have been so blessed to have been under care with Dr. Amie Bend for the last 6 years, being that I just feel a huge improvement in my health. I have a great immune system. My digestive system is wonderful. I feel that from the inside out, I have taken care of myself and listened to my body. I sleep wonderful at night, and I pretty much live pain-free, especially compared to how I used to live. I used to suffer from really bad headaches, and I don't anymore. I had low back pain because of scoliosis, and I have just been blessed and will never stop using chiropractic care for my life.
Welcome back to Phenomenal Health. Here's your host, Dr. Jeff Hawkins.
Hi, welcome back. I have with me today Dr. Amie Bend. We're talking all about why chiropractic has become so popular. Now, Dr. Bend, as we went to the last break, we had the first trivia question, which was, are headaches caused by a lack of Tylenol and aspirin?
Right. No, that's not the problem. Basically, a headache is caused usually by a subluxation, and that's when the vertebrae in the upper back area, which are much smaller than these, actually have rotated and irritated the spinal nerve, which will then create muscle tension and problems with feeling headaches.
All right, Dr. Bend, so if someone comes into your office and they're complaining of headaches, what would you do to find out what's causing it?
What I would do is I would palpate their spine. I would put them on our SAM machine, which it does a bilateral weight distribution test,
Right.
and then it also assesses for asymmetry in the spinal column.
Okay.
And so between those two things, I would find out if that patient has some misalignments and some muscle knots, and then I would proceed probably to an X-ray so I can determine if there's any misalignments in their spinal column and then where those misalignments would be.
Right.
And then after that, I would proceed with having the patient go home to prepare for adjustment, and then I'd have them return on that next day so that I can show them their X-rays and then possibly adjust them right on that next visit.
Okay, I mean, and I love that analysis that you do, because I know that's one of the complaints I have about some of the people in medical professions, that people will come in complaining of headaches, and all they do is give them Tylenol, give them aspirin, and they really don't look at what's causing the problem. So again, it goes back to what we talked about in the first segment, where they're just putting a Band-Aid on it, covering up the symptom, but not correcting the cause, which sounds like what you're doing is a lot different than that. So now explain to us then, we hear a lot of times that chiropractic is great for low back pain, as far as correcting it. So explain why that is and how that would work.
Well, the reason it's helpful for low back pain is because oftentimes the spinal joint gets compressed with repetitive stress or lifting injuries.
Okay.
And so what happens is the spinal joint gets rotated, and then the vertebrae presses on the spinal nerve, or the spinal disc gets irritated or inflamed because of compression. Okay, so what chiropractic does is it re-stimulates nerve flow into where the nerve flow isn't getting, and it restores motion in the joint so that pressure can be removed off of the disc, so that the spine can actually heal itself naturally again.
Okay, all without drugs, all without
Right.
surgery. Okay,
Correct.
so now what about neck pain? It sounds like it might be similar kind of concept, but what do you think causes most types of neck pain, and how do you?
It's repetitive stress, it's sleeping wrong, okay? Those things actually irritate the spinal nerves again. It can also just be from actual mental stress, can create a lot of tension in your spine and in your neck area.
Now, why should somebody who's been in an auto accident come in and see you instead of just going to the emergency room, getting some muscle relaxers and painkillers, and that's it?
Well, oftentimes there's a lot more soft tissue damage than are noted in an emergency room. You'll get out of the emergency room, clear as a bell, no broken bones.
Right.
But what will actually happen is the spinal nerves and joints will be inflamed, and the body will swell, and those nerves can actually deteriorate over the course of weeks after the accident without you necessarily feeling a lot of pain.
Okay.
And that could be detrimental on a permanent basis if you don't get in there almost immediately and restore where those joints have been irritated.
Okay, so then in a car accident, then the spine, like we've been talking about, can get misaligned out of position because of the trauma?
Absolutely, because it's your car, the weight of your car, and the weight of the car that hit you. In physics, there's a lot of stress on your spine that happens,
Right.
even if the car doesn't hit at a very high rate of speed.
Okay, and so again, if they don't get that corrected by a chiropractor, then those joints can stay misaligned forever then.
Right, and if that happens, what happens again, as we showed on this chart here, is if the joint is irritated, the spine can actually dry out because it quits moving individually. The body will fuse itself just like in a broken bone, and the joints will stop moving. So it'll go into self-repair, and maybe you'll ignore the problem and have a little stiffness and take your over-the-counter medications. And then over the course of your life, your body will dry out and actually become arthritic, and you don't even realize it's because the car accident you had 5 years ago.
Okay. Now, if someone's been had a work injury, injured on the job, should they come in and see a doctor of chiropractic?
It would be the quickest way for you to get back to work again. Most people want to just get back to work and feel better, and chiropractic is the quickest, non-invasive way to get yourself back on track again so you can actually go back to work.
Okay, so again, it sounds like all of this, the symptoms, different types of pain that we talked about today in this last segment, is all related, like you mentioned before, is if the bone is out of place, pinching on the nerve, it can cause all kinds of pain. And the only way they're going to know if they can get that handled is to come to you.
Correct.
Okay, so why don't you tell people again watching about the different offers that you have on a regular basis?
Well, what we do is usually on a monthly basis we offer some kind of promotion. So what we do is we will have our monthly promotion. So when you call in, just call us and ask us what that promotion is, and we will give that promotion to you.
Okay, Doc, I really appreciate you giving those offers on a monthly basis to the people watching. So we have to take our next break right now. When we come back, we'll keep talking about this, okay? So sit tight. Now, if you're suffering with any type of pain and you're looking for a natural way to correct it without using medications or surgery, then you need to call Dr. Ben's office and make an appointment to see her. As a doctor of chiropractic, Dr. Ben has special training at correcting most types of pain in your body. And if you're tired of taking medications that just cover up your symptoms and you're looking for a natural way to correct the cause of your pain, then you need to call Dr. Ben's office now. When we come back from our next break, we'll continue to talk about why chiropractic has become the most popular form of non-surgical and non-drug treatment for pain in the country. We'll be right back.
Hi, my name's Rich and I'm a chiropractic patient. I first met Dr. Ben about 5 years ago. I didn't really know what chiropractic was. I actually thought that chiropractors were just people that help other people get better after they got in an accident. I didn't really know what it could do for you if you're just in pain or were sore. So I met Dr. Ben. I was telling her I have all this pain. I type a computer all day, got a lot of shoulder pain, neck pain. She said, well, how's your ergonomic station, and why don't you come to my clinic and I'll check it out for you. And so I came to the clinic and she explained to me what chiropractic is, and I went through the process of her diagnosing me, and it was really scientific. She ran some tests on me, she took x-rays, and then she showed me my x-rays, and I was just taken back. When I saw my x-rays, she spotted out the problems to me right away. I mean, it was obvious just looking at my x-rays. I had like lower back issues, and that was probably from a previous accident I had been in where I got hit while I was on my bike. I never did anything about it, and she said, well, yeah, this is what happened to your back, and this is how your upper back is. That's probably what's causing your shoulders to be sore. And I couldn't believe it, and I started care right away. After a few adjustments, about a week, I was feeling better, and after a month or two, I was feeling great. And I went through the whole care plan, and when I was done, I decided I was going to go back on a regular basis, get adjusted, because it just helps me feel healthy. It helps get everything connected again, and I love it. And I'm so glad I met Dr. Ben. I found out I got chiropractic. I would have never known. I would have gone the whole rest of my life without knowing. And it's great. So it helps me keep a healthy lifestyle.
Welcome back to Phenomenal Health. Here is your host, Dr. Jeff Hawkins.
Hi, welcome back. With me today, Dr. Amie Bend. We're talking all about why chiropractic has become so popular. Now, Dr. Bend, as we went to the last break, we had the next trivia question, which was, can medical doctors do what doctors of chiropractic can do?
Well, the answer is no, because we specialize in different things. Chiropractic specialty is in spinal column and assessing and determining if a patient has a subluxation, or a medical doctor determines if there's wounds and things that the body needs from medicine to heal it. So they're not really the same profession.
Okay, so it's kind of like a difference between dentistry and medicine.
Yes,
Like you wouldn't go to your medical doctor to see if you need a cavity filled, right?
Correct.
Okay, so I want to make sure that people really understand that, because I don't want people thinking at home that, oh, okay, well, this sounds really great, so let me go ask my medical doctor if I should come and see Dr. Bend.
Right.
That's not necessary, and they're
Right.
really not qualified, are they?
No, 'cause they'll determine after an accident if something's broken and if it needs to be, medically treated, but they don't really see what the chiropractor will see on an x-ray. I've had lots of patients come in and say, well, the medical person said that I was okay after my car accident,
Right.
when they had really bad misalignments in their spinal column that really needed serious attention from a chiropractor.
And now, do people need a referral from their medical doctor to come and see you?
No, they don't.
Okay. Now, again, that's a huge thing I want to make sure people really understand, Dr. Ben, is because we've done the research. Everyone seems to assume that medical doctors are trained in all aspects of healthcare, and they're not. They're not trained in chiropractic. They're not trained in nutrition, exercise, acupuncture, any of the natural healthcare fields. They're not trained in that. They're really just trained in medicine and doing surgery. Is that right, or is that wrong?
That's correct. And chiropractors are trained specifically to correct the spinal column for misalignments, and they don't
Okay.
have the extensive training that a chiropractor has on spinal misalignments.
Okay, so if they think that they have some kind of a chiropractic problem, they need to come and see you and not get an opinion from their medical doctor, because it's really not their training.
Correct. That would be
Okay,
correct.
so now, how safe is chiropractic? I know that's a big issue like people have. Is it safe? Is it not safe?
Oh, it's very safe. There's hardly any evasiveness that's even done with the chiropractic adjustment. In our clinic, we take x-rays, so we take all the appropriate measures to determine whether you need to be adjusted, and do that in an effective manner that's very gentle. So it's
Okay.
very safe.
And because you don't prescribe medications or perform surgery, that's got to be a huge thing right there too.
Right. Very little risk, because we aren't doing anything that evades the natural parameters of your body's health.
Okay, now what can happen to someone's spine, Dr. Ben, throughout their life if they don't take care of it properly?
Well, what happens is gradually, if you have these subluxations, sometimes they're referred as fixations in the spine,
Right.
that the spinal joints will stop moving, and you may not even know it, just like you have a cavity that you don't know about, and it can actually stop moving individually, and the bone and the joint doesn't move to let the fluid get in, and then
Okay.
that fluid can actually dry out, and then the bonding of the bones actually happens. They try to fuse with each other over time.
Okay, so it can kind of degenerate then if you don't take
Yes.
care of it?
Yeah.
So that, I mean, you look at this model, and when I've gone to my dentist's office, it looks kind of similar to where you have a normal tooth, and then if you don't take care of your tooth properly, you get this decay. That's kind of what that model looks like to me. Is it sort of similar?
Yeah, it actually is something that deteriorates over time, and you may mask it by taking some medications over the counter to make the problem or the symptom feel like it goes away, but
Right.
actually your body could be internally deteriorating without you even knowing it.
Okay. Now, I know, Doctor, you brought a little video clip of your office, so let's go ahead and take a look at that right now, and you can explain to us what we're looking at, okay?
What that is me showing an x-ray to a patient, and we're explaining the different conditions that are on that film so that the patient understands what they need to come and see me for, and how important it is to get adjusted, and how important it is for them to understand their own conditions so that they can take good care of their own bodies.
Okay, that makes sense. I mean, you want to be able to see with the x-ray what's going on with the spine before you do anything, so I mean, it's good that you do that, because it's kind of like the blueprint, right, of the person's body inside. Okay.
Correct. Yes,
So now,
absolutely.
Now, why don't you just kind of summarize for us now, Dr. Ben, some of the ways that chiropractic can help, again, with different types of pain in the body, because we're sort of running out of time, so I really want to make sure we end the show with reiterating to people exactly what chiropractic is and how it's great for eliminating pain.
Well, what it does is it removes nerve pressure, and that nerve pressure can contribute to numbness, tingling, pain, headaches, TMJ, low back pain. All of those things happen because there's pressure on spinal nerves, and what chiropractic does is it finds where those pressure points are, and it removes them for you so your body can heal itself naturally.
Okay, and so remind people again of what are some of the normal things that can cause these misalignments. I mean, you mentioned some different types of stresses. What can actually cause your spine to get knocked out of place where it can put pressure on these nerves?
Slips, falls are the obvious ones. Repetitive stress, holding your child on your hip for days on end.
Right.
Also, sitting in your car and sitting in traffic for hours during the day. And sports activities are another obvious way that you can actually get injured. Things that are repetitive over and over again, bending over, yard work, all those things create imbalances in the spinal column that can create subluxations.
Okay, and then again, the only way they're going to know if they've got their spine misaligned is to come in and get a checkup by you or another chiropractor, right? Because that's really what you focus on.
Correct.
So I just want, again, I want to make sure people understand this, that they can actually have problems in their spine and not have any pain. Is that correct?
That's true too.
Okay, and so again, if even children or younger people can literally have problems in their spine, it doesn't have to be an adult. Is that right?
That's correct as well.
Okay.
Anytime that you would take anything for over the counter, people think that, oh, okay, well, I don't need a chiropractor. But oftentimes, if you need to take something over the counter, then there's probably something wrong with your spine and you need to have it addressed.
Okay, so again, I just encourage people that are watching to come in, get a consultation. If they've never gotten the checkup by a chiropractor, they should come in and see you, to see if you can help them with the problem. So, okay, Doc, I really appreciate you being on the show right now. Will you come on again in the future and answer some more questions for us?
Absolutely.
Thanks a lot, Doctor. Appreciate it. Now, I encourage everyone who's watching tonight to call Dr. Ben's office and make an appointment for a checkup. You could be suffering with pain right now needlessly. As a doctor of chiropractic, Dr. Ben has special training at correcting spinal problems that cause pain. And if you've never gotten a spinal checkup for yourself, then you need to call her office and make an appointment. When you call her office and mention you saw this TV show, she will give you whatever special that she has going on this month, and she has several on a monthly basis. So call the office and find out. Now, Dr. Ben is going to give you these gifts on a monthly basis as a community service to help you come in and check out and see if your spine has any problems. Now, it is possible to have spinal problems and not know it, so call her office now before it's too late. I want to thank you for watching this edition of Phenomenal Health. Have a great day.